Many patients come to see me and they've been told that they're not a candidate for a disc replacement because they have spondylolisthesis. In terms of understanding if a disc replacement or a fusion is the best option for a patient, we have to understand a little bit more about spondylolisthesis. Now, in our spine, the discs are in the front and they're the cushions in between the bones. But when we move at any given segment, we move across the disc in the front of the spine, but it also works in a team with what we call the facet joints. Those are joints in the back part of your spine. As we live our lives, there's movement across our discs and our facets, and that's what gives the flexibility to the spine. For some people, as the disc degenerates and the facets become a problem, they can develop a situation where one bone starts to slide forward and backward on another. And if instability develops, that can be called spondylolisthesis. That just means slipping of one spine bone on another. Not my fault. Now, patients who have a small amount of spondylolisthesis developing may still be a great patient to undergo a disc replacement. A disc replacement is a surgery where the disc is removed and an artificial implant is put in to replace and restore the disc. Now, for a disc replacement to work, the facet joints, the muscles, some of the other structures of the patient's spine still have to be in decent shape. So yes, patients with some spondylolisthesis are able to get disc replacements, but there are times when the spine becomes too unstable, it's too far gone, and then a disc replacement is just not a good option. And for those patients, they should consider a fusion. In that situation, you're much better off with a good fusion than with a bad disc replacement. In terms of making the final decision, there are a number of factors that we need to look at, and they're related to how healthy a person is, what their body size is, how strong their bones are, and the instability and their nerves. And we have to factor all those things together to really determine what the best option is for any single person with spondylolisthesis.